Happy Wednesday, everyone. Happy Women Wednesday. Let's just wait a few minutes for people to join us, and then I'll go ahead and get started. Hey, Paul. Hi, everyone. Happy Women Wednesday. So glad to see you all here today. Hello. We're going to get started in 1 minute, and then, yeah. Okay. Right. Happy Wednesday, everyone. Has everyone had a good day so far? Let's see. Okay, so we'll go ahead and get started. We're at 5:04, so we'll get started now. So my name is Ibuku Amale, and I'm a social media program coordinator here at Whitman-Walker. And today I actually wanted us to talk about Cervical Cancer Awareness Month, which is the month of January. And since today is a Women's Wednesday, this is something that is more tailored to the women. So I'm really excited to talk to you all about this. So before we get into the topic, I just wanted to mention that you might have seen Whitman-Walker, our community health department, expand its outreach efforts to the social media platform. So you've seen us come on here and talk about various topics. So you've seen us talk about HIV, STI, sexual health practices. We've talked about access to care. We've talked about COVID a bunch. We've talked about the social determinants of health. So over the next few months, you're going to continue to see us talk more about COVID-19 and also ways to just manage your sexual, personal, and mental health. So I just want you all to remember that the community health team is always here to support you and educate you, always. So like I mentioned, today is another Women's Wednesday, and we're going to actually be discussing Cervical Health Awareness Month. So cervical cancer, cervical health are kind of interchangeable. But the month of January is definitely dedicated to that. And today I just wanted to talk a bit about what it means to maintain one's cervical health, as well as highlight some common issues associated with cervical health, such as HPV and, of course, cervical cancer. So now I want us to first talk about what cervical cancer is. Does anyone know anything about cervical cancer? Do you have any idea about what it may mean? Let's see. So just to talk about it, cervical cancer is a disease in which the cancer cells arise in your cervix, which connects the uterus to the vagina. So the main cause of cervical cancer for most women is usually a long-lasting infection with certain types of human papilloma virus, which is also known as HPV. So like I mentioned, HPV is a really common virus that is actually passed from one person to another through sexual intercourse. So it's defined as an STI because it's a sexually transmitted infection. And cervical cancer does not tend to affect women younger than 20 or older than 50, but many women do not realize that their risk of developing it decreases with age. So really what I'm trying to say here is that not the prime time for a person to get cervical cancer, because you can get it at any age, but the most common time that's been found is around 20 to 50, so middle-aged women. So very few cases are actually diagnosed in women over the age of 65. So, hi, Joseph's house. So like many cancers, cervical cancer may not actually present any signs of its presence in its body during the early stages. So hence, that's why people really know cervical cancer as a silent killer, because it typically doesn't show any symptoms until you are at like a really late stage. So, however, some people might have some warning signs. So they might not have like symptoms, but they might have some warning signs that may present themselves as the disease continues to progress. So some of these signs could be pain while you're having sex or bleeding while you're having sex. If you have back pain, if you have unusual discharge, so if your discharge is of a different color or different texture or has a different smell to it. And also some people might experience pelvic pain, among others. And there are also certain factors that increase the risk of developing cervical cancer. So these can include smoking, having multiple partners, having unprotected sex. Remember, a common way to get cervical cancer is through HPV, which I mentioned is an STI. So if you're having multiple partners and having unprotected sex with them, you're kind of increasing your risk of exposure to HPV, which then increases your risk of having developing cervical cancer in the future. As well as having early sexual activity. So the reason why smoking is a factor that could increase your risk of developing cervical cancer is because smoking lowers your immune system, which makes it harder for your body to fight off any HPV infection. I mentioned it earlier, but HPV typically, like most people will have HPV at some point in their life. But the reason why it's not a big deal for some people is because typically our body should be able to fight it off. So we get the infection and then it just disappears on its own. It's able to just go away on its own. In the cases that it doesn't go away on its own, that's when there's a risk of developing cervical cancer. So that's why having a lower immune system due to smoking, you are then making it harder for your body to do its job of fighting off HPV. And like I mentioned, having unprotected sex with multiple partners increases your risk of coming into contact with someone infected with the virus. And also having a close family member who has suffered from cervical cancer can also increase your risk. There's also some genetic factors that play at hand here. And there are also links to the prolonged use of birth control after 5 years or more with the disease. So I've mentioned a few factors that can actually increase your risk of developing cervical cancer, and they were smoking. They were having a close family member that might have had cervical cancer before, so a genetic factor. And then they were also having unprotected sex with your having multiple partners that you have unprotected sex with. Those can also increase your risk of developing cervical cancer in the future because you are increasing your risk of exposure to HPV. So now that we've talked a little bit about kind of what cervical cancer is, I want us to talk a bit about HPV. So we typically don't talk about HPV a lot here because we don't actually test for it. So like the STIs we test for are chlamydia, gonorrhea, and syphilis. We don't test for HPV. But it's still a very common sexually transmitted infection in DC as well and in nationally. So at any time, there's approximately 79 million people in the U.S. with HPV, and there are multiple types of HPV. Some of them can cause genital warts, while the ones that I kind of want to focus on today are the ones that actually can cause cervical cancer cell changes if they're not detected early on. So the specific kinds of HPV that actually cause or can increase your risk of developing cervical cancer are type 6, 11, 16, and 18. So I want you to take note to that because when you get tested, this is kind of what your doctor is looking for to see if you got this specific type of HPV. And then that's kind of like a sign that you might end up developing cervical cancer in the future. So, as you may know, there are Hpv vaccines available, and typically you get them when you are a preteen, so between the ages 11 and 12. That's really when you're supposed to start your 2-series dose. But you are eligible to receive the vaccine up until ages 45. So if you feel like you haven't gotten your HPV vaccine yet, and it's not too late, as long as you're not older than 45, you're still eligible to receive the vaccines. And the difference is if you are under 15, you receive the 2-dose series of the HPV vaccine. But then if you are over 15, it's a 3-dose series instead. So now that we've talked a little bit more about testing, or well, not testing, but the prevention, which is getting the vaccine, I wanted to talk a little bit more about how testing works for HPV, as well as the possible detection of cervical cancer cells. And also, by the way, I just want to ask if anyone has any questions so far. I saw that we had a few people join us. If you have any questions, please leave them in the comments. And also, No Filter DC is pinning or leaving some pretty good comments that you should take note of. But basically, the best way to find cervical cancer early is by having regular screening tests. So the same way we say get screened for STIs and HIV frequently, this should also be part of your annual routine. So you should try to get tested for HPV or to see if you have any irregular cancer cells in your cervix yearly, or typically when you start off the first year. Are men asymptomatic when they get HPV? Yes. So that was another thing I was going to mention, is that HPV typically is asymptomatic for people. So that's why it's important to get tested regardless of your gender. Because although today we're focusing more on women, but HPV can also cause a man to have penile cancer and things with their reproductive organs. So yeah. Can someone age 46 or older get the HPV vaccine? So currently the cap is 45. So if you are 46 or older, you're actually not eligible anymore to get the HPV vaccine. So there's kind of the two main ways of getting tested for this. So one, there's just the regular HPV test, and then there's the Pap test. So these can be done at the same time or different times. The most important thing is just get it done. So the standard right now is women typically get their first test or start getting screened at age 21 up until 65. So if you are 21-year-old and you're going in for your first test, your doctor might say you're all good. You don't have to come in again for another 3 years. That's typically the standard right now. But we still recommend getting tested annually or biannually if you can. Do I ask my gyno? Yes, so you should reach out to your gynecologist or whoever is your provider and ask to see if they have any available appointments to set up these tests. Thanks for the question, Rama. So are HPV tests different from Pap smears? Yes, so HPV tests are different from Pap smears. So Pap smears are looking for irregular cell growth or irregular abnormal cancerous cells in your cervix, while HPV tests are looking for specifically the virus in you. So basically, these screening tests can help find any abnormal cells so they can be treated before they turn into cancer. So one thing I do want to note is if you believe that there might be a financial burden which might affect you from being able to access the screening test, while doing research, I found out that the CDC actually has a program which is called the Breast and Cervical Cancer Early Detection Program, and they have them located in basically in every state in the U.S. So I looked up the address and the number to call if you're in D.C., and that number is 202-442-5900, and they're located at 899 North Capitol Street, Northeast, DC. So how effective is the HPV vaccine? So the vaccine is very effective. Most people who get HPV vaccine don't actually end up if they get in contact with the virus, through a sexual exposure, they actually end up having no symptoms, or their body's able to fight it off almost instantly. So yes, it's very effective. And then there are other tests available for you. So you could ask for a tissue sample, which is basically they would remove a sample of tissue from the body, which is called a biopsy. And cervical tissue is removed usually under local anesthetic, and then is then examined for any precancerous cells indicative of cervical cancer. And there are several different types of biopsy methods depending on an individual's requirements or circumstances. So these are all different things you can do, but I would recommend speaking with your gynecologist or your provider just to make sure this is the right thing for you and the right step for you. And then also you could also request for a cervical exam. So this involves your doctor examining your cervix using a special device that is called a colposcope, which basically it shines a bright light in your cervix, and they're able to kind of look at it with a magnifying lens and really just examine it with their own eyes. So that's a cervical exam. So if you feel like you might have you have a history of cervical cancer in your family, definitely advocate for yourself when you go to your gynecologist for a cervical exam. And another option is just getting a lab test. So like I mentioned before, a Pap test can involve a nurse or a doctor taking a scrape of the lining of the cervix in order to obtain a sample of the cervical cells. So this sample will be checked into a lab for any abnormal changes in the cells, which could potentially go on to become cancerous if not treated. So does anyone have any questions so far? Thank you for asking questions, though, but that was helpful. So I just have one last thing to share. So like I mentioned before, the earlier HPV, so HPV is very common, and it can be passed from one person to another during sexual contact. This isn't something that should be stigmatized. Like, almost everyone is going to get in contact with HPV. But the benefit of it is if you've had your vaccine, it just kind of like goes away on its own. And in the cases that it doesn't, that's when it leads to cancer. So to spread awareness about cervical cancer, I really urge everyone to try to discuss everything that we mentioned today with the women around you. So like your friends or your mother or your sister, or like really just anyone in your community that you feel would benefit from having this discussion. It's really important for us to just, raise awareness about how, yes, vaccines work and there's preventative methods you can take earlier on to prevent you from, developing cervical cancer. And I also want you to have these conversations because a lot of women are still not aware that this cancer exists, and they're not aware that there's certain steps they can take earlier on to prevent it from developing. So one thing I want to say is if you have not personally scheduled a test, try to set a goal to set a test this year. We're still, we're in the first month of the year and we still have a lot of time to schedule it. So I really just want to urge everyone to kind of just take that first step and get it scheduled. And due to its lack of symptoms, cervical cancer is often diagnosed in its later stages. So that's why I keep saying get tested earlier rather than later. And like we know with any other cancer, survival rates decrease the later the diagnosis. So the earlier you're able to diagnose if you have cervical cancer or not, if you have cancerous cells, the better your survival rates are for that. And before we end off, I do want to shout out a few organizations that I found to be helpful, that are actually doing the work about raising awareness about cervical cancer. So that's the first one is the National Cervical Cancer Coalition, NCCC. And then there's the Foundation for Women's Cancer. And then there's an organization called Cervivore. So I will link that in the comment section once I post this if you want to check them out or see if they have any other resources for you. But I found them to be pretty helpful when I was looking for resources for myself and also just trying to educate myself more about what cervical cancer is. But that's basically all I have for everyone today. Do we have any final questions before I end the live? Let me put it in the comment section, actually. Okay. All right, well, if we don't have any questions, I just want to say thank you so much for joining me today on this Women's Wednesday. And I hope you learned something about cervical cancer, and I hope I've kind of planted a seed in you to help raise awareness about cervical cancer for yourself as well as other women around you. So before we go, I do want to give a few reminders about COVID and the COVID-19 vaccines. So if you've already gotten vaccinated, I just want to say congrats. You've taken a really important step to preventing yourself, your loved ones, and your communities from illness. As you've probably heard, there's a bunch of different variants going around, and it's totally understandable why you want to keep wearing your mask. We still urge everyone to keep on staying alert. If you haven't been vaccinated and you are looking for an appointment, I do want to let you guys know that we do offer the COVID-19 vaccine at Whitman-Walker. So you can call us at 202-207-2480 to make an appointment. And if you're having a problem reaching out to us and you do live in DC, the number to call is 1-855-363-0333. And if you're in Maryland, you can call 855-634-6829. And if you live in Virginia, you can call 877-829-4682 to make an appointment. They're scheduling, just regular first dose, second dose, as well as boosters. And if you haven't been vaccinated and you are not looking for an appointment, we still urge you to please follow the CDC guidelines for, wearing your mask, quarantining, social distancing, washing your hands, everything and anything with hygiene. Just try to follow it if you're not getting vaccinated. It's important that you continue to follow these guidelines, not just to protect yourself, but also to protect the people around you, because you don't know the vaccination status of anyone around you. And finally, another resource you can go on if you don't live in the DMV, if you're looking for an appointment, go on vaccines.gov to schedule an appointment. So finally, I just want to say, follow us on Instagram, TikTok, Facebook, Twitter at Whitman-Walker, and also check out our website at www.whitmanwalker.org. So I just want to say thank you guys for tuning in today, and I hope you have an amazing rest of your Wednesday. Bye.